Okay, so today I'm going to be talking about diabetes. I actually was diagnosed with type 1 diabetes when I was 15 months old, so very near and dear to my heart. But I knew animals could get diabetes, obviously, but I was kind of curious about whether they could get type 1 and 2, which we'll talk about later, but they can. So I'm going to delve into that today. So there are two different types, like I said. There's actually gestational diabetes too, but that's more of a short-term kind of diabetes. So type 1 is insulin deficiency, and your body is completely unable to produce insulin, and it's due to an autoimmune effect caused by, obviously, your white blood cells attacking the pancreas, and it's not reversible. Whereas type 2 is insulin resistant, and so your body is unable to respond to the insulin being produced, and then because it's unable to respond to the insulin because it's tired, it eventually stops producing as much insulin because it's not being used. But this is reversible. So here's like the normal feedback loop of diabetes. So when someone has, or I guess a normal person, someone has a high blood sugar, normally your body would send a signal to your pancreas to promote the insulin, and then the insulin is released to both your cells, which uptakes the glucose and stores it in those cells, and then also to your liver, which turns the glucose in there into glycogen, which is the storage form. And then this causes your blood sugar to lower, and then once it gets too low, a signal is sent to your pancreas to release glucagon, and then it goes to your liver again to then turn it back into glucose to then raise your blood sugar. So essentially, in diabetes, your pancreas can't do its job, so this whole middle section doesn't work so great. So I have glucagon that I carry, which I carry in my backpack with me all the time, and you can also give it to animals since most mammals are insulin dependent. You don't use it as much to manage your diabetes, but if the blood sugar were to drop significantly and essentially the animal or person would become unconscious, then you can inject this in them and it will rapidly increase the blood sugar.
So you carry glucagon, you're saying?
Yeah,
Okay.
it's in my backpack.
Yeah, okay. I'm just
And then this is insulin, which is, as I said, the primary form in mammals. So this is most often what we manipulate to get the blood sugar in range in diabetics. So I have an insulin pump, which is not here, but this is my insulin pump. And then, or you can take shots, which is most of the time what happens in
tequila
animals.
shots?
No. No. It's also really fun when you're like talking about your blood sugar and you're like, I'm high, and then everyone's like, and you're like, no, not that kind of way. Just me, my body. So causes, both have genetic causes, obviously, but then something I found interesting with type 1 is that there's an environmental trigger. So that's something kind of, in type 1, there's antibodies, and they're high concentrations, they're called ANAs, and then essentially something will cause those to attack a certain part of your body, and in type 1 diabetes, it happens to be your pancreas. And then in type 2, there can either be genetics for obesity or other endocrine conditions where the levels of hormones are off, because if one's out of whack, it kind of throws everything out of whack. So symptoms, both are pretty much the same, with excessive thirst, frequent urination, and then urinary tract infections due to the sugar coming out in the urine. In type 1, there's weight loss and eye issues due to the pressure in your eyes being higher. But I was talking to someone who had type 2, and they said that weight loss is not a thing, but that type 2 is diagnosed by an A1C, which is essentially an average of blood sugar. So like blood sugars is a single point in time, whereas your A1C is kind of like your range. And then treatment, so in type 1 you can supply insulin, so shots after food or if the blood sugar gets out of range. The insulin, releases the glucose, as we talked about earlier. And then carb counting, just to make sure that you understand how many carbohydrates are being sent into your blood. And then watching your exercise, so if you kind of are able to tell whether your blood sugar is being able to go or starting to go low or not. So if you're walking all over campus or really exercising your dog, making sure that doesn't happen and they don't pass out or anything. And then regular checkups for eyes and feet due to the blood pressure and circulation issues. And then another way that's kind of new is a continuous glucose monitor. So that's some option for some people, and we'll talk more in detail about that in just a second. Or to check your blood sugar to make sure that you're in your 70 to 120 range for at least me as an individual in my 20s. And then for type 2, it's mostly weight management and a diet, and that's kind of like the first tier of treatment. And then if it's more severe, they can give you a prescription. And I tried to research what this was specifically did, and some websites said that it removed sugar from the kidneys, which I was kind of confused about. But essentially it would promote the uptake of insulin, which would then in turn regulate your blood sugar. And then if the next tier, if it's severe enough, would be to like directly give insulin to the person as well. So this is a video about Quincy the koala, who is in the San Diego Zoo, who has type 1 diabetes and uses a continuous glucose monitor, which is what this is.
Okay.
And we don't make sound.
Okay.
So here they're checking his blood sugar through a little prick in his ear. And then that's a meter, which then tells you what it is. And then this is them giving him his insulin,
Oh, wow.
which he seems
Okay.
happy about. And then this is them actually inserting the continuous glucose monitor. So I also have one, and it's not this scary, I promise, but
It looks like taped on there then?
yeah,
Is it
so
just
there's
tape?
like a adhesive patch that's part of it. So this is the part that is actually the sensor. So this is the part that's actually the sensor, and there's a little tube that goes into your skin and essentially measures
When
the
they
blood
put it in.
sugar of the interstitial fluid.
Okay, well, let's see.
And then this is the transmitter, which is able to use Bluetooth to then send it to phones or devices. And that's
Okay, I
it.
didn't know there was like a little needle that went into the skin.
So the needle goes in and comes out and weaves the like little tube. Okay.
Does it just go in when you're measuring it? Is that what you're saying?
No, so like here. In this applicator,
Mhm.
there's a needle. So the tube is around the needle, and then the needle goes in,
Okay.
and then the tube stays in.
The
needle
tube
comes
stays
out.
in. I got
Yes.
it.
Okay.
Yeah, I got
And then here's the phone that they're using to like monitor the blood sugar, so it's trying to connect right
you.
now.
Mhm. Almost looks like a sheet, but it reminds me of wool coating. Look at those claws. Holy smokes.
So then here is one of the veterinarians, I imagine, and they're able to then track his blood sugar and get the blood sugar at any moment. And then they can also check for patterns. This is really handy to check for patterns if like at certain times to adjust like the insulin that they're giving him as basal or background and all that fun stuff. And so then this is a little bit more on them. So it allows constant data, which then allows better control because like I said, your blood sugar is an instantaneous point instead of like if I were to take my blood sugar at like noon and it would say 170, it wouldn't be 170 until I checked it again. It's constantly changing. So then it kind of allows for you to see how much control you have because you can check it and it can always be in range, but it might just be in range because you're checking it at consistent times, whereas it's like going up
Mm.
and then coming back down, and you just happen to be checking it, and then they look right. And then these are about $100 per one, and then they last 10 days, and it's really nice because they've approved this for making blood sugar adjustments on it, so you don't have to constantly like stick your finger like they stuck his ear, so it is like less on animals as well as humans. And then it's also a precursor for a closed loop system, which is a really cool thing where your sensor picks up your blood sugar and then it can send it to a pump, and then your pump can stop
Adjust.
insulin or give more insulin based on the way that the blood sugars are trending.
Now, when you say precursor, that means coming down the road, that will be
Yeah.
possible?
So right now my
Yeah.
pump will suspend if I start to go low and I get in a certain range, but it doesn't have
That
the
feedback.
technology to go do the same for up.
Mhm.
But if it would, then it would be considered
Mhm.
like a closed.
And that's coming down the road, probably.
Yeah.
Let's give her a round of applause. Excellent way to keep the animals in there too. Questions, comments? I'll let you point.
Yes.
So around like what age, do you know if like children or like what age like animals would like develop type 1? Because I know like I have a cousin and he didn't develop it until like he was 5 years old.
So it's very tricky. I guess the question is, how would you be able to know what age type 1 would be developed? And it's very tricky because it kind of all depends on that environmental trigger that changes. So, like, I was diagnosed very early, but no one else in my family has type 1, so, like, you kind of just have to look out for the signs of, like, the frequent urination and the weight loss, and most doctors are pretty good about knowing that it's type 1, but just kind of being on the watch for that.
Does insurance cover your checkers on your arms?
Yeah. So, some insurance companies do, I thankfully do have a nice insurance, so they are able to cover it, and it's like, so I wear it on my arm all the time, and it's super great. So I'm able to know, like, in cost or not, if I'm starting to go low and manage that, but, not people who have no insurance or poor insurance aren't able to, which is very unfortunate at this time, but the FDA is trying to prove it to act like a meter. So meters are sold for pretty cheap in like Walgreens and CVS, and they're trying to change it so that this is the new way of doing that, because you are able to make adjustments and like decisions based on your blood sugar from
Yeah,
your
your
system.
data. I get a question. Environmental triggers for type 1. Can you give me an idea? I'm drawing kind of a blank. Are there known ones, or is it just unknown environmental triggers?
It's very tricky. My mom likes this. She's gonna hate that I know this. She likes to think that mine was due to me having chicken pox and then getting the chicken pox vaccine closely after that, just because it was such a like shock to my immune system with those two being like very close together. But other than that, it's pretty much when your immune system decides to.
Okay. And something might
attack
trigger it, and it's just, there could be any number of things.
Yeah.
Any number of things, but the endpoint is diabetes. I mean, is that, you know?
Yes.
You talked about like the blood sugar ranges about like what's safe versus high versus low. Is that consistent among different animals, or does it kind of depend on the species?
I'm sure it depends on the animals. So obviously his was 300, whereas if I were 300, I would be feeling like crap. So I'm sure that probably they all want to be in that same like A1C. So like the lower A1C is better, and if you have like a consistent around 200, that's about an 8.0 like A1C. So obviously the lower the better control you have. Like I said, the A1C is kind of like an average of your blood sugars, so it can be kind of skewed where sometimes you have consistent lows but also consistent highs, but your A1C can be that of like the average because you're averaging that but not consistently staying in that range. So
You can always look up the normal glucose levels for any animal, especially domestic animals. And it might be in Google, but I know I have books called Clinical Chemistry of Domestic Animals or Clinical Biochemistry of Domestic Animals. And there's all these charts in the back. Normal hematocrit, when they're pregnant, when they're not, Sometimes breed of horse makes a difference for things. So it's all kind of known, but I'm not, didn't know about that. That did seem high. Was that milligrams per deciliter?
Yeah.
Yeah, so that would be crazy high.
Yeah.
I think you get one, any more?